3 years old lady who has come to us. She is saying that she has diabetes also, and she has pain in abdomen. And this pain in the abdomen is there for last say 17 years. She has been in my follow-up regularly, as she says, and whenever she has symptoms, she attends to the hospital. Now, previously this was epigastric pain, and she was diagnosed many times as gastritis, and she was given medical treatment and she responded. But today she has come with a new complaint, which is black tarry stools, and this is for last 2 weeks. Previously, in last 17-18 years, she did not have this. So now the question is, black tarry stools, or she says kali tatti aati hai. So when we inquired, she says that it is just black as this cloth. So there are 3 types of bleeding per rectum. One is known as hematochezia, the second one is known as malena, and third is known as occult blood in stool. So when it is fresh blood, red in color, then it is known as hematochezia. When it is black and tarry is sticky, जिसे रोड पे कोल टार डालते हैं उसके रोड बनाने के लिए, it's like that, jet black and sticky in nature during defecation. So that is the typical presentation of malena. And the third type is occult blood. That means the stool color will be normal, but when you test it for fecal or occult blood, it will be positive. So these are the 3 types of bleeding per rectum, but all of them have certain clinical features. For example, if it is fresh blood in stool, it indicates that probably the bleeding is from the left side of the colon and sigmoid and rectum. This is the area where fresh blood arises, and it can be for a variety of reasons. Of course, the first reason you have to exclude is piles. Piles is a very important cause of bleeding per rectum. Other than piles, there can be polyps, there can be neoplasia, there can be ulcerative colitis, there can be even Crohn's disease sometimes, and sometimes any other lesion which affects from the splenic fracture to the anal verge. It can lead to hematochezia, which is red, fresh bleeding per rectum. The other type of bleeding is black tarry stool, which is usually an upper GI bleed, and it generally starts in the stomach, duodenum, and sometimes the esophagus also. So all these 3 areas, if there is profuse bleeding, but since the blood which comes out is at that time it is red, but with the hydrochloric acid in the stomach, it changes its color, and during transit the color changes till it reaches the rectum, where it is clinically appears to be black in color. So if it's a malena, then it is usually an upper GI bleed. If it is hematochezia, it is lower GI bleed, usually left side of the colon and anorectum. Now the third thing is occult blood in stool. So occult blood in stool is suspected by the doctor. Say, supposing a patient has a colon malignancy right-sided. So obviously the features will be, sometimes you will say pain hota hai, there is a lump or something. So this needs to be confirmed by occult blood in stool. So occult blood in stool is present, then more likelihood of a lesion occurring on the right side of the colon. So these are the 3 types of bleeding. Now how to investigate? Supposing this lady is with us and she is saying black tarry stool is coming for last 2 weeks, and she is a known case of gastritis for last many years, and she is on this pantoprazole and other drugs. For whenever she has aggravation, she takes the medicine. So now in this case we will just like to do upper GI endoscopy, because that will show us the whole of the GI tract up to the duodenum. So that will confirm or say that it is not present, either way. So it is the best method of investigation for any upper GI lesion. It may be ulcerative, it may be say gastritis, it may be malignancy. So for malena, the best investigation would be an upper GI endoscopy, which we are planning for this patient. Now supposing it is hematochezia, fresh blood in stool, then what is an investigation? Then the investigation before that is clinical examination. That means you do a clinical digital rectal examination. That is the first thing. First inspect, and after inspection, if there is no fissure, there are no piles apparently outside or a fistula, then you put your finger in and try to feel for any polyp or any growth which is possibly felt rather than seen. Now, in spite of that, you are unable to locate it, then you put a proctoscope. That will first of all show you a fistula, internal opening, or it may show you a pile mass. It may be at all the three places or at one place or two places. That is the most common. Before that, you have to rule out fissure, because acute fissure also causes bleeding per rectum. So the investigation of choice is after inspection, you do a proctosigmoidoscopy. And if the range of this is only up to 10 centimeters. So if the lesion is at a higher level, I told you from the left side of splenic flexure down. So to reach the splenic flexure, you need to have a sigmoidoscope. So that will be able to inspect the whole of the sigmoid, and it will come up to the at least distal colon. So that is the minimum evaluation which is needed. And for occult blood in stool suspected, you do a test to find out the stool is positive for occult blood or not. So these are the three short methods of knowing whether bleeding per rectum is from the upper GI tract or the lower GI tract, or from other side which is not detectable clinically, but it's positive for occult blood. Is that clear? So in this patient, what we are planning is to do an upper GI endoscopy, as she is a known case of gastritis for last many years. That may have aggravate and may result into an ulcer, and that can cause acute bleeding. Is that clear? आप लोग जा सकते हैं. Thank you, sir. तो बेबी आप आ जाइए मंडे को.